for the university system, and quite frankly, for the entire state of Maryland. We can never make up for that loss. But we can and must learn from what happened, how it was handled, and make any necessary and appropriate changes to ensure that it never happens again. Since assuming responsibility for this investigation in August, the Board of Regents has been entirely focused on making sure we can get as many facts as we can so we can make fully informed decisions about any actions we take to help prevent similar tragedies in the future. As you know, Dr. Walters' investigation is one of 2 independent reviews. Today's report is, in my mind, the first step in a 2-step fact-finding process. Separately, an 8-member commission is reviewing the overall culture of the football program at College Park. We will give that body the time and independence they need to get the facts. When they have completed their work, they will report their findings to the Board of Regents. The board will then make whatever decisions necessary to safeguard the well-being of our students, and will share that information with the public transparently. I also want to note that we shared the findings with Jordan McNair's family last night, and what we are sharing today is with their approval. With that, I want to introduce Dr. Walters. He is a renowned expert and national leader in athletic standards of care. He's president of Walters, Inc., a leading national consultant in sports medicine. An athletic trainer for more than a quarter century, including 17 years at the University of South Carolina, Dr. Walters was recognized as the National Athletics Trainer Association's most distinguished athletic trainer in 2003, and was inducted into the NATA's Hall of Fame in 2005. As a consultant, he has worked with the NCAA, Major League Baseball, and the National Football League. I want to thank Dr. Walters for taking on this very difficult task. Dr. Walters, it's all yours.
Thank you. Walters, Inc. was contacted on June 12, 2018 to conduct an external review of the University of Maryland incident of May 29, 2018. A contract was received on June 21st, signed on the 25th, and began receiving documents for review on June 29th. The initial scope and summary was to review the procedures for the University of Maryland and were the procedures appropriately administered on May 29th. Signs and symptoms of exertional heat stroke can be characterized by a varied presentation of the symptoms, with the 2 main criteria being elevated rectal temperature greater than 104 degrees and central nervous system dysfunction, including irrational behavior, irritability, emotional instability, headaches, confusion, nausea or vomiting, diarrhea, muscle cramps, loss of muscle function, inability to walk, collapse, staggering or sluggish feeling, profuse sweating, decreasing performance or weakness, dehydration, dry mouth, thirst, rapid pulse, low blood pressure, and quick breathing. The treatment of exertional heat illness should be rapid recognition, rapid assessment, rapid cooling, and rapid advanced medical care. Acclimatization is vital to prevent exertional heat illness. The gradual increase in practice intensity and equipment worn has been established to address acclimatization. Increasing breaks with modifications of the work to rest ratio also help with acclimatization. The conditioning session was initially scheduled for the Maryland Stadium, but it was moved due to construction. The second option was a Cole field house, but changed due to the poor availability of field space. Thus, the decision was made to move to the practice fields. It is essential that sufficient time be allowed to ensure minimal medical equipment is set up by the athletic training staff prior to any practice being initiated. In review of the University of Maryland policies, the Emergency Action Plan policy meets guidelines. The exertional heat illness procedures meet standards, but there were concerns outlined in the report. The development of a timeline was the initial fact that I tried to do, to establish a timeline to record the events that happened. Some of the findings of the timeline detailed in the report are highlighted as follows. The time from the onset of cramps to being moved from the field was 34 minutes. The time treated in the athletic training room prior to the change in patient status was 23 minutes and 55 seconds. The time from the 911 call to departing the stadium was 37 minutes. The onset of symptoms to the call to 911 was 1 hour and 7 minutes. The time from onset of symptoms following the 7th repetition to departure of the ambulance en route to Washington, Venice was 1 hour and 39 minutes. It should be noted, the University of Maryland has a good system in place with staffing of certified athletic trainers and integration of team physicians. There is a need for better integration of this service. While there was a delay in identifying the severity of symptoms, once these symptoms were identified, there were efforts to cool the patient and address the respiratory concerns. The injury evaluation did not include any assessment or documentation of vital signs, including core temperature. There was the failure to identify escalating symptoms associated with exertional heat illness, including assessing vital signs, identifying the condition, and aggressively treating the patient's elevated core temperature. No apparatus was used for prompt cooling of the patient. Inadequate cooling devices were used, such as cold towels, ice packs, etc. The pre-hospital care of exertional heat illness should include rapid recognition, rapid assessment, rapid cooling, and rapid advanced care within 30 minutes of the onset of symptoms. This was an atypical presentation of a heat stroke, secondary to running 10 110-yard conditioning runs. The summary recommendations that we've made. Number one is develop a coverage model. The coverage model is the understanding or a text version of the emergency action plan, the plan for a venue-specific approach to the emergency action plan that will be shared with all administrators, all staff, for broad understanding. Number two, a venue-specific emergency action plan should be developed, practiced, and posted at all sites. The emergency action plan should be adjusted daily in light of construction. The WBGT, the Wet Bulb Globe Thermometer Index, needs to be implemented for all venues at the University of Maryland. Cold water immersion devices need to be available for all training, conditioning, and practice activities. Policies and procedures for cooling patients before transport to the hospital must be explicitly stated in an emergency action plan and shared with potential EMS responders so that treatment of exertional heat stroke and exertional heat illnesses are understood by all medical personnel, and this is appropriately coordinated. Any person with oversight, influence, or impacting personnel caring for the health and welfare of student athletes, including at the University of Maryland, athletic training, strength and conditioning, psychology, and nutrition, should be outside the influence of coaches. It seems prudent to provide oversight of all positions dealing with student-athlete health and welfare by a person within the athletics healthcare administrator. And finally, organizational charts, job descriptions, and mission statements should reflect the roles and expectations for deliverable healthcare services to the student athletes. Thank you.
Thank you, Dr. Walters. Your work has been excellent, and it's been a joy to work with you, I would tell you. As you know, the Board of Regents received these findings a few hours ago. Thanks to Dr. Walters' efforts, we are much better informed. I also understand that many of these recommendations related to student health and safety have already been addressed by the university. But this is only the first step in the fact-finding process. Dr. Walters' findings will now be provided to the separate, independent, 8-person commission and will inform their work. Once the board receives the commission's findings, we will be in a better place to make any final decisions or take any actions. We will not act, judge, or speculate before all the facts are in. Open the floor for any questions that you all might have.
Mr. Brady, what is your number one takeaway from this report? What reassured you or troubled you the most?
Well, with any report like this, there are recommendations that make a lot of sense going forward, and I'm very much concerned about that going forward thing. But the fact of the matter is, we are dealing with a tragic event here. And that tragic event is the death of a 19-year-old football player at the University of Maryland. So we don't want to lose any sense of the tragedy that exists there. But as a practical matter, we are very anxious to learn from this experience and be able to provide the best care and protection for our student athletes going forward. So coming out of all of this, Dr. Walters has presented a litany of recommendations that we want to implement, not only at College Park, but at all of the other institutions in the system that have football programs. So I wish we could say that we could bring Jordan McNair back to life. That would be the greatest thing that we could possibly do. That cannot be done, and the tragedy that the McNair family has had to deal with cannot be overcome. But we can use this experience to make student safety of our student athletes much better and more focused than might have been in the past.
Sir, does the report or the timelines tell you anything about the role of Coach Durkin and what his proximity to all of this may have been and what actions he may have taken personally or not taken?
Actually, no, it does not. It does not get into all of that.
Mr. Walters, you rattled off a lot of times, the time from onset of symptoms, and can you explain what those times mean? Put them in context. Did the ambulance ride take too long? Did the 911 call take too long? Can you go through what was done properly and what should have not taken as long?
As you look at the report, I think it's very clear that the time that he was taken from I don't remember all those times, but I think there was 25 minutes or so on the field, and then he came inside and there were 25 minutes in there. At 5:50, he had a significant change, and that was when we talk about that mental status change. And at that time, that's a concern because he had some respiratory issues, et cetera. So at that time, that's when you think you have a heat stroke. And they made a call to the physician, then they called 911. And so I think at that point, there were definitely efforts to cool. My point was I think if we'd done cold water immersion, it would have been more effective. But we did try to cool. And the reason why they didn't do cold water immersion because he's a large person, and the staff is not as big as he was. And there was concern for his condition to put him in a large cold whirlpool. And that was what was explained.
In your opinion, had the athletic training staff or any of the coaches followed proper protocol and recognized this, would this heat stroke have been avoided?
You know, the literature tells us that if we identify heat stroke within 30 minutes of a heat stroke and do cold water immersion, we identify the elevated core temperature, that is best practices. That didn't happen that day, and that's all I can say.
Sir, you said this was an atypical presentation of the heat stroke. Could you illustrate that for us, help us understand what you mean?
You know, basically the things that he complained about that was noted in the chart, and that's what I have to go on, were things like back cramps, just low back pain, cramping, and it doesn't go to all those other things I talk about as far as, you know, the changes in stature and that the instabilities and those things. So I mean, It didn't present like you just wouldn't think heat stroke when you only run 10 110s. But at the same time, that's what developed, and that is concerning.
So, Mr. Walters, are you saying your recommendation would be for the university to have had a cold water immersion equipment at the practice field,
Right.
and within 30 minutes would have had them in that water?
I think today's best practices would do that. And I think you see that across the country at a lot of institutions, at many institutions now. So we have venue-specific plans now. As far as to identify, we want to rapidly assess that person, rapidly identify, and rapidly cool that patient as quickly as we can.
And if I could follow up, were you also saying that someone other than a member of the coaching staff should be the one to assess the health of the student athlete?
No, what I said, and I did not say that. What I said was that the athletic health care administrator, anybody dealing with the student athlete health and welfare, should be underneath that person, including psychology, nutrition, athletic training, strength and conditioning.
I thought you said it should not be under the administration of coaches. Did I hear that?
That's correct.
Should not be.
It's the athletic health care administrator. That's who they should be under.
So then there should be an independent person at the practice?
No, I'm talking
don't
about administratively within the department. The NCAA identifies today a position called an athletics health care administrator. We're all about independent medical care. So we want to make sure that person that oversees that care has that designation from as far as the NCAA talks about that person being the health care administrator.
Did anything in your investigation show that Jordan McNair was forced to do more after he showed these signs? Was there anything that head athletic trainer Wes Robinson said? Can you tell us what happened during that time?
Did not show anything there. Great question. He did pass 7 of his 10 runs. So his first 7 he did pass. The 8th, 9th, and 10th he did not make his time for that. But there was nothing there. He did complete the next 2. His last one, I think his teammates went back and ran with him and to kind of bring him along.
Did they run with him, or did they carry him?
I was not told that he was carried. He was running, and they were kind of holding him on the side and coming with him.
Did you have any video to see?
There was not. You know, we did have videos. I used videos to establish the timeline. And so speaking to the timeline, that was a challenge to kind of know when different things happened that day. So we used surveillance videos, different things like that. And we could only see the end of the run. We couldn't see the entire thing. So we didn't have good access to and you couldn't make a lot of detail out, quite frankly, but you could see when they started and stopped just as far as the time codes.
How many players and coaches did you interview?
I interviewed all the coaches, all the athletic trainers, all the strength coaches. I think there were 6 student athletes. It was a sign-up deal. They could come in, and we had an open times for that. But I think there were 6 student athletes.
Was the sign-up anonymous?
I don't know what actually, I don't remember the actual mechanics of it. It was announced to the team, and I think they could sign up on with the football operations guy. I think that's how it was named. Is that correct? And then on a subsequent visit, I offered it again to the student athletes if they wanted to come in. So I tried to be as accessible as I could. We actually did that in the Student Health Center. We had no sign up on that. I wanted to give them a chance to come in and talk.
So why wasn't there anything in the investigation about the role of the head coach in all this? Because on Maryland's website, it did say that DJ Durkin was on the field during that time.
He was on the field. I did not say he wasn't. But I just said that he didn't provide any care. My deal was the procedures specific to the protocols at the University of Maryland and where they followed that day. And I interviewed every assistant coach because there were questions I wanted to ask them. And I did interview all the coaches.
Sir, I think you mentioned taking temperature. I'm looking at the timeline. I'm trying to follow.
Yes, sir.
What I understood from what you said is nobody really ever took his temperature until the EMTs got there, or even beyond that. If I got that right?
That's correct.
And is
There was
the
nothing recorded, nothing that was told to me as far as,
all the trainers, no
Yep.
individuals I'm reading about here. So and I believe what you're saying is that the ability to take a temperature and take that action fairly early should be in a protocol.
we're talking about a rectal temperature, that's correct. That should be part of it. If we identify signs and symptoms, we would want to assess that. And I think that's being talked about a lot of places today as their best practice to do that.
Saying that's part of the recommendation here. Not only to have the ice available, ice bathroom.
Exactly, identify.
Temperatures on the field when
Yep.
there's any question.
Yep.
Okay, thank you, sir.
Say if they didn't institute cold water immersion due to a fear of drowning, do you feel that that was a valid concern? And how do you assess that decision made by the trainers?
It's a decision they made. They were there, I was not. So, I mean, I think that's, you have to, we have to understand that. I think you understand these are reputable people. I'm not negating that. At the same time, they're not large people, they're not big people, and they were concerned about the safety of the student athlete if they got him in a polar plunge. This is not like a traditional tub. Realize, just for logistics here, many of your facilities today, you go in these facilities, they have very nice, large, 20 people cold whirlpools. And that we're talking about a tub, which would be ideal for treatment, like a watering trough that we use for horses. That's what a lot of places use for these cold tubs. So that is what would be ideal.
Mr. Walters, you
Here
said,
on page 71, you meant there appeared to be a lack of appropriate implementation and failure to recognize the severity of the incident. Is that really what set this whole chain of events on, in that they were not sure or didn't know they were dealing with heat stroke?
Well, I think when he presented it at 5:50, when he had that change, obviously they knew something major was wrong. It talks a lot in the notes there about trying to cool the patient. So I mean, I think that's identified, and that's when I asked specifically why they didn't put him in the cold whirlpool, and it was concerned about that. So I think as those symptoms did escalate, there was concerns about that.
Well, would you back up what Dr. Lowe said, that there were mistakes made in the treatment of Jordan McNair, and what Damon Evans said, that both acknowledged there were mistakes made in the treatment?
Hindsight's 20/20. Now let's remember that hindsight's 20/20. And I think if we would have identified it earlier, and I think if we'd identified that early, it might have changed things. But I think we have to have a plan. We have to identify those escalating symptoms, and if they are elevated, if there's something abnormal, have a treatment plan. Remember what I said, active or rapid assessment and rapid cooling, so that we can do that.
you said there was surveillance video just of the end of the run. Can you describe what his condition was at the end?
It was, ma'am, I couldn't make anything out of it from the condition from the video. It was a street video, so it's basically just, safety videos that you have on campus, those street deals there. So that's what I looked at. And I was looking at mainly for times as far as to establish the timeline.
It says West yielded the interns. Is that West?
What's that now?
It says West yielded the interns. On page, I don't know what page this is here. Is that a typo? Is that West yelled at the interns?
I'm not sure. I'll look at that when I get off. Thank you.
Are you able to make a determination, sir, whether this was an unfortunate accident or negligence?
No, I would not make that.
Thank you.
Okay, thank you very much.
Mr. Brady, how about you for that question? Do you believe there was negligence here? Do you back up Dr. Lowe's acceptance of moral and legal responsibility?
I am not in a position to make that call at this point in time. I think there's a lot of information we're gathering, and I am not prepared to make that call. I am prepared to say that the death of this young man is a tragedy. Let there be no doubt about it, and we all feel very deeply about that. But we are in the process of gathering the facts, and I'm a fact guy. I like to know what the facts are before we make any conclusions about things like that.
When do you expect the second investigation to conclude?
Pretty soon. I know that's not the answer you were looking for, but it's moving along very rapidly, and I expect we will have an announcement in the not-too-distant future as to when we will have the final report and make it public.
Why didn't the McNair family see this report last night?
They did,
I mean, before last night?
because we didn't see it before last night either.
Have you heard from them since? Have you heard from them today, the McNair?
Well, they gave us the okay to issue the report. If they had asked us not to issue it, we would not have issued it. The McNair family is very important in this whole process. But remember, the board saw this a couple of hours ago, and some of us saw it last night, and a decision was made to make sure that the McNair family had access to it before this press conference.
Since the board oversees so many different universities, how long will it take for you to decide when or if to buy the kind of equipment that Mr. Walters was talking about and to implement this kind of training and protocols for every student athlete and team across the entire system?
Well, a number of the recommendations have already been implemented because they were discussed during the course of Dr. Walters' investigation. I don't have a timeline for exactly when all the others will be implemented, but my expectation is that they will be implemented with great, as fast as possible, because I think now we have a very clear sense of what we need to do to perform one of our primary functions, and that is to protect our student athletes.
Thank you.
Yeah. Thank you very much. Appreciate it.